So when we look at a cochlear implant, this is your brain, your temporal lobe of your brain. This is the mastoid, which is part of the skull, and here's your inner ear. And what we're doing is we're simulating the cochlea. And you can see on this model that there is a receiver stimulator that is attached to the skull through an incision behind the ear. This is an operation that's done under a general anesthetic. It takes about 45 to 60 minutes to complete. And we do this mainly in the outpatient setting unless you have medical indications saying you need to be treated in the hospital. The receiver stimulator is placed, the mastoid is drilled open, and the cochlear implant electrode is inserted into the cochlea. And it's just like a Cinderella slipper phenomenon. That cochlea houses the electrode full of these stimulating sites that then can pick the nerve fibers that are still living and stimulate them to bring hearing. So if we look at each of these components separately, the implantable component looks just like this. So you have a silicone wrapped package where this is the computer that we wear underneath the skin. This is what we call the receiver stimulator. And through the skin, we attach with a magnet the what we call the behind the ear processor, or the external components that are responsible for receiving the signal, crossing over the skin, gets picked up by a loop of coil here, an induction coil, which feeds it into the computer. The computer then takes the programming that's typically done by the audiologist who's caring for you, runs it down the electrode, and this is the active electrode that actually sits inside the skull in the cochlea and stimulates those nerve fibers. This is a simple grounding electrode, which is a component of this particular cochlear implant. The actual processor is worn outside the skin, and this is actually a computer chip-driven component as well. The magnet goes to this skull, and it would attach to the outside of what we see on our model here. When programming these, you typically would go to your audiologist. They set what we call cochlear implant maps. These can be adjusted by you with a handheld device like this. It's a remote control for your cochlear implant. What's really fascinating is all of the programming can now be adjusted by patients through their cell phones. So patients have a lot of control of the way they hear. So that's the cochlear implant device itself. What is cochlear implant surgery like? What is the process like? Well, typically you'd be identified by an audiologist or hearing professional as having a significant hearing loss. You then undergo an evaluation by an audiologist with specific testing that's all determined by the Food and Drug Administration. If you qualify with your audiometric test, you see an ear surgeon or an otolaryngologist who will then do a workup, including an examination to make sure your ears are anatomically able to handle a cochlear implant. And that includes a CT scan or an MRI to look at the inner ear structure and to make sure that there's no anomalies in the development of your inner ear, and to make sure that you have the nerves that are necessary to conduct the sound. Once you get through that process and you're determined a candidate both medically by the surgeon and audiometrically by the audiologist or hearing technologist, we then put your package together and we send it off for pre-authorization to your insurance company. Prior to going to your implant surgery, you get a vaccination to prevent against meningitis. So now that you've been audiologically evaluated, medically evaluated and cleared, you've got your vaccination, we're off to surgery. We do it as an outpatient with you going home the same day. But this is an operation that takes, in my hands, less than an hour. You certainly can't drive your car home. You have to have somebody drive you home. But people are awake and talking and fairly excited when they have their cochlear implant done. The pathway and journey to really adapting to your cochlear implant is really determined by how much you use it. Device programming, device design, and cochlear implant indications are expanding rapidly. And I can honestly say that between hearing aids, osseointegrated devices, middle ear surgery, and cochlear implants, there's very few people who can't have a hearing intervention. The last device that's really not used often, typically in patients who have neurofibromatosis or are born without hearing nerves, is the auditory brainstem implant. And the brainstem implant, instead of being put in the cochlea, is actually placed through the skull into an area in the brainstem to simulate the brainstem nucleus that provides hearing directly. We don't use these very often. They do not typically perform as well as cochlear implant patients, but we do have the opportunity and the ability to place a brainstem implant if needed. Again, these are typically people who've had large tumors on both sides of their brainstem and have no other hearing option, or patients who are born without an auditory nerve but we can ascertain as best as possible by the MRI scan that their brainstem looks normal, we would consider them for a brainstem implant as well. That's done with the neurosurgeons, with the neuromonitoring team. It's very complex surgery, and it's something well within our envelope of services that we can deliver. So we're very excited about the hearing technologies and very excited to help people hear.